So, hello everyone. So, dear first year BDS students, today we'll be beginning with the basics of anatomy. So, dear students, as we have discussed in our previous sessions, that in gross anatomy there are 14 chapters. So, each chapter is equally important. So, all those chapters we'll be dealing in our next session. So, today's is basically the basics in anatomy. Before going into any chapter, you should be aware of the blood supply, nerve supply, lymphatic drainage. So these things are the ones which repeatedly come in the chapters. And many students find it very difficult to remember what is this blood supply, what is this nerve supply, and what are branches of what. So that is really a difficult task when it comes to the first year BDS students. So, in the basics, what I suggest and what I prefer all of you is to learn the basics first and then go into individual chapters on a sequential manner. Right, so let's begin. So, first and foremost, what do you mean by cranial nerve? Right, so this is very important. What is cranial nerve? Right, so now the name itself tells cranium or cranial. So, definitely it is basically something related with the cranium. What is cranium? Cranium means your skull. The head part is called cranium or the brain, you can call it. There are two types of nerve, cranial nerves and spinal nerves. Now, before going into this cranial and spinal, now I'll just give you an example. Suppose you are living in a city of Bangalore. Example, you are sitting in Bangalore. So in Bangalore, one incident happens on the road. Some roadblock happened, something, some tree fell, something happened. Okay. And it is a very serious thing which has happened. So, how does the mechanism of these politicians or the administrative section works? Do you think the prime minister will directly come to Bangalore and check out what is happening, or the prime minister, president, anyone like the senior most in the administration in the country? Definitely not. If they want to know what happened in that particular city, town, that road, the head of the country will ask the subordinate, maybe the group of ministers they may ask. So there is sports minister, there is health, there is finance. So definitely they are not going to come to Bangalore and find out what happened. They will tell the next subordinate level, and like that it will come to the state chief minister. Chief minister will not come. He will tell the local MLA over there to find out. The MLA will not come. MLA will tell the local police officer or the superintendent to find out what happened. Definitely, the DGP of the police is not going to come on the road and check. So, again, subordinate, subordinate, subordinate. In the last, one constable may come and check what happened. So, an information which was at the topmost level, it came to next level, next level, next level, and it came to the grassroots level. And the constable saw what happened, and then he again narrated in the upward fashion. So slowly it will passes, the information passes from 10, 15 levels and it reaches up to the prime minister. This is just an example. So this is how in our body also the master control organ is the brain. So from the brain all the informations will go to different parts of the body and it controls the body. But do the brain come to your leg and tell you? Definitely not. Brain will not come. So brain will give the information through the nerves. These are the messengers. So these nerves are the ones which carry information from one to another, and at the grassroots level, the nerve which is local to that area will give out the instruction and take out the information. So I hope I'm very clear about this. So this is just a example what I told you. So the cranial nerves. So dear students, there are 12 cranial nerves and these numbers are fixed. We cannot change the number. These are fixed. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 cranial nerves are there. Now, the first one is olfactory, second is optic, oculomotor, trochlear, trigeminal, abducent, facial, auditory or vestibulocochlear, glossopharyngeal, vagus, cranial accessory, and hypoglossal. So there are 12 cranial nerves. Now, how to remember this cranial nerve? So you are just the basics. It's a basics class. It's a first BDS class. So first of all, how to remember this, I will tell you. These are the cranial nerves. These are different ministers. Like one is sports minister, one is health minister, one is agriculture minister, one is finance minister. They have different functions. They supply different organs. Right? So these are the 12 ministers who are under the brain. Brain is the prime minister. So one mnemonic you can remember like this. O O O, to touch and feel a garam vada aha. If you can read this 2 3 times, you will learn the mnemonic. O O O 3 times. O O O, to touch and feel a garam vada aha. It's a mnemonic, and please understand that mnemonics does not have a meaning. Don't try to find a meaning in the mnemonic. It is just for us to remember a difficult thing in an easier manner. That's it. Please do not find meaning in mnemonics. It may be funny, it may be really astonishing, it may have no sense, it doesn't matter. Now see, O, 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 3 times O. So olfactory, optic, oculomotor. So this all three starts with O. To touch, trochlear, trigeminal. And feel, abducent, facial. A, auditory, garam vada, glossopharyngeal, vagus. Then aha, accessory, hypoglossal. So this is a method how which you can remember. There may be different mnemonics also. Please learn in whatever format you can, but this is the way how you should know. So if you just take a screenshot and 2 3 times if you learn this, it's very easy. Now you see that the first three, that is olfactory, optic, oculomotor, all three are starting with O. So definitely confusion can come. There can be a confusion. Now see the first nerve, olfactory. Now imagine you're passing by a road and on the side of the road there is a factory. So generally the image of factory, what? A bad smell may come, smoke will be there, pollution will be there. So that is just a scenario. So factory means smell, bad smell, that you remember. And then optic. See, I'm wearing opticals. We go to optical shops, right? Optics. Optics or optical means your eye, that you know very well. Okay. So now olfactory, factory, smell, bad smell. So smell, how do we smell? We smell through nose. How do we see? Second one, optic, through our eyes. So you have how many nose and how many eyes? This is my question. You have how many nose, how many eyes? So you have one nose and two eyes. You have one nose and two eyes. So one nose, through nose we smell, factory, bad smell. So olfactory becomes first cranial nerve. We have got two eyes. So the second cranial nerve is optic. So it's very easy now. Olfactory, smell, first cranial nerve. Optic, two eyes, vision, optic nerve. So automatically the third one becomes oculomotor. So this is how you can learn between these three nerves. So these are the 12 cranial nerves you should learn. In this 12 cranial nerves, you should know in depth. In future course of our classes, we will study in depth about fifth cranial nerve. That is the trigeminal nerve, extremely important. It can be main question. And then the seventh cranial nerve, that is facial nerve. Again, a main question. And short essays can be glossopharyngeal and hypoglossal nerve. And even oculomotor nerve, the third cranial nerve. So this is basically neuroanatomy section. You will study that. But when you're studying any other chapters in gross anatomy, so many nerves will come. So that is why I am putting it this as a very first basic class. So this is still not over. Now see this. This 12 cranial nerves from 1 to 12 we have discussed, they're attached to the brain. So our brain is here. So in the brain, some are attached in the front part, some are attached in the middle part, and some are attached in the back part, posterior part, you can call it. So, in your school, you would have studied a poem. 1, 2, buckle my shoe. 3, 4, knock at the door. 5, 6, pick up the sticks. It's just a rhyme for LKG students, or not even LKG now. This is for the preschool students now. Same funda, we'll use it here. 1, 2, 4 brain, the front first part. 1, 2, 4 brain. 3, 4 mid brain. 5, 6, 7, 8 pons. 9, 10, 11, 12 medulla. So these are the 12 cranial nerves from where they originate in the brain. So 1 and 2 means first cranial nerve and second cranial nerve. The names are this. This we should learn in order. The mnemonic I have given you. So 1 and 2 starts from the forebrain. 3 and 4 midbrain. 5, 6, 7, 8. 7, 8 facial nerve. Fifth is trigeminal nerve. If someone asks you where does the trigeminal nerve originate, it originates in the pons. Facial nerve originates in the pons. Hypoglossal nerve, 12th cranial nerve. 9, 10, 11, 12. Where does this 12th cranial nerve originate? Medulla. So it's so simple. So if you learn this basics, you can tell the origin of anything. Now, these nerves have some functions. Now, as I told you, there was a prime minister from their group of ministers, and then the other level of ministers, the CM, it goes to MLA, MP, it goes down, 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 and up to the road side, that is a constable, we went. From top till bottom, we went. So information is coming from the brain to the site, and from the site, it is going towards the brain. So it's a two-way communication. Like you would have seen some roads where vehicles will go in both the direction. But in national highways and all, you will see that only one direction road is going and another direction road is coming. You cannot do the reverse in other roads. It's a one way. So this 12 cranial nerves are also function on the same basis. Some cranial nerves are one way. Only they do one way information. That is from the brain to the, suppose a candle is burning and my hand is there. So if candle is there, my hand burns. So an information, I'm not knowing it. Candle is there, my hand comes near it, I feel the heat. So a heat has to travel and it goes to my brain. So information is going towards the brain. Then my brain processes, oh, it's a candle or your hand is burning, take out your hand. Then information should come from the brain towards the hand to take out the hand. So one is going towards the brain and one is coming from the brain. So there are two ways. It is two here. Two things are here. So these are called sensory, motor, and mixed. What is sensory? Sensory means any information which is going towards the brain. Towards the brain. Now you can see me, right? So whatever you have seen, you have captured the image and it has gone to your brain. Whatever I am telling, your ears are hearing, it is going towards your brain and you're understanding it. So whatever goes towards the brain is called sensory, sense organs, sensory. So the cranial nerves are 1 to 8. You can remember like an intercom number, 128. So cranial nerve number 1 is olfactory, smell. 2, optic, what you are seeing. And 8, vestibulocochlear. So nose, eyes, and here, vestibulocochlear. This 3 cranial nerves takes information towards the brain. Right? So this is sensory. Then comes motor nerves. Information from the brain which comes towards the organ. Those are called motor nerves. As I told you, candle was burning, my hand was near, information went, and then my brain told, take out your hand. So that is motor, which is coming from the brain towards the organ, is called motor. So I hope I'm very clear. Sensory means information going towards the brain. Motor means information coming from the brain. It's all one-way junction. Only one going up, one coming down. But as I told you, there are some. So motor is 3, 4, 6, 12. These numbers you should remember. Okay, 3, 4, 6, 12. Out of the 12 cranial nerves, 3, 4, 6, 12. So we have got sensory going towards the brain, motor coming from the brain. Whatever remaining are mixed cranial nerves. That means the same nerve will take the information from the brain towards the organ and from the organ towards the brain. Both way, that is mixed. That is why the name is mixed. So I hope I'm clear. Please see this class again and again. It's there in YouTube also. Learn this, pause this, understand the concepts, and then after learning all these basics, when you come for the very first class of our gross anatomy, it will be dead easy. I assure you that, see that class, it is going to be dead easy. Right. So see here. This is the mnemonic called SAME. 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 Sensory are also called as efferent, and ME. Motor are also called as efferent. This is the other name. See, we all have nicknames, right? So everyone will have some or other nickname. Same way, if when I am telling sensory nerve, that means I am telling efferent nerve. And when I am telling motor nerve, that means other way of calling is also efferent, E. So sensory are also called as efferent, and motor is also called as efferent. So just remember a mnemonic saying. So dear students, till now we have learned two mnemonics. One is for the cranial nerves, all the 12 cranial nerves in an order, and second one is for this. That is the sensory and motor cranial nerves, right? Now coming to the functions of this cranial nerves. So you can take a screenshot, the functions. It's very simple. First one, olfactory, smell. Second is optic. So that is for your vision. Third one is oculomotor. You will study in extraocular chapter, muscles of the eye. It supplies there. Trochlear is again for eye movements. Trigeminal is for the general sensation of the face. Abduction is for eye movements. Facial is for muscles of facial expressions. So this all things you will learn in different chapters. So this will come once you do the gross anatomy part. This is going to be very easy. So these are the 12 cranial nerves and their functions. So based on the function, this is where this cranial nerves act. So this diagram depicts that. First cranial nerve is olfactory, so nose. So you have got one nose. Second one is optic, so two eyes. Third one, oculomotor, that is the extraocular muscles. So like that. Fourth, this is the trochlear. Trigeminal nerve is 5, that is the face. This is just like one funny diagram or a mnemonic or whatever you call it. You need not learn this. You should know where it acts, how does it function. That is more important. This diagram is not of any importance. This is just to learn in a funny way. That's all, nothing more than that. Okay, so the tongue, your 9, 10 and 12 cranial nerves, your trapezius muscle, sternocleidomastoid muscle, your 11th cranial nerve, that is your accessory nerves. So like that, all this. 8th is vestibulocochlear, so this is here, 8th. So this is based on function, one diagrammatic representation. Right, so till now we have discussed the cranial nerves in order. How many of them are sensory, how many of them are motor, how many of them are mixed, from where they originate, that we have studied. Now, second learning from today's session, cranial bones. How many cranial bones are there on your skull? So you can remember with the mnemonic, PEST of 6, PEST, PEST of 6. So the first letter of each, PEST, P, parietal bone, E, ethmoidal bone, S, sphenoidal bone, T, temporal bone. So PEST, PEST of O, occipital, that is backside. This is frontal bone. Right. So total 6 bones are there. 1, 2, 3, 4, 5, 6. So PEST of 6. You can remember like that. 6 bones are there. Now, this is the communications. Your arteries and veins are communicated. You study about the arterial system. Then you study about the venous system. So please understand your arteries and veins at one point of time, it is communicated. Like rivers are there, oceans are there. The river water will flow and go into the ocean. So that connection is also there. So same way, arteries and veins are connected through capillaries. That is what we'll be studying. So arteries, you know that at arteries carry good blood, oxygenated blood. This good blood goes to tissues and organs. Organs utilize that and gives out carbon dioxide. So this carbon dioxide goes into the veins. So from the artery, now I am the organ, any organ, liver, lung, anything, kidney, you imagine. From the artery, I took the good blood, I utilized it and gave out carbon dioxide. So carbon dioxide went to veins. So I took from artery oxygen, I made into carbon dioxide and made it into carbon dioxide and gave it to veins. So from the veins, it goes to the heart. This is your cardiac cycle, that is your physiology. So superior vena cava from the upper part of the body, inferior vena cava, lower part of the body, it goes into the right atrium. That is the cardiac cycle physiology. And from the heart, it goes to the lungs for oxygenation. So the carbon dioxide blood through veins, it goes again to the heart, and from the heart, it goes to the lungs, and again CO2 becomes O2, and it comes out from your, what you say, left atrium to left ventricle, and from left ventricle through arch of aorta, it is distributed to the whole part of the body. So what I am going to talk right now actually is the blood supply of head and neck, right? The blood supply of head and neck. So from the heart through arch of aorta, the whole blood is supplied towards your head and neck. So this part I am talking head, neck. So this part we are going to study now, the blood supply of head and neck. So this we have already discussed now. So from where it starts? It starts from the heart. So now, for example, the river Ganga. Ganga is a river, Ganges you can call it. So this river originated from a glacier called Gangotri. So similarly, the blood supply of head and neck also should start from a point, and that point is arch of aorta in your heart. From the arch of aorta, so that is the Gangotri, the glacier from where the blood supply starts. So let's discuss that. So see this arch of aorta. So please understand, concentrate, take screenshots. This is the one which will really make your anatomy very easy. Right? This slide and the next slides when you learn this. So I will be telling you all the branches. You should remember from top to bottom and from bottom to top also. Reverse order also, you should be able to tell that. Now, arch of aorta, where it is? It is in your heart. Where in the heart? At the level of second costal cartilage. At the second costal cartilage. So please remember that second costal cartilage, this is present. So this is the origin, Gangotri, blood supply of head and neck. Now imagine arch of aorta is like one grandfather. Grandfather. So grandfather has three kids. How many kids? Three kids. So these are the three kids of the grandfather. Right brachiocephalic artery, left subclavian artery, and left common carotid artery. That means from the arch of aorta, you are getting three direct branches. The three branches are right brachiocephalic, right subclavian, left subclavian, left common carotid. So if you observe carefully, you see here, one is right and two are left. I hope I'm very clear. One is right and two are left. So it is right brachiocephalic artery and then left subclavian and left common carotid artery. All these three are direct branches from arch of aorta. Okay. So now is a grandfather. So three kids. So for a father, the daughter is always correct compared to the son. Just hypothetical, just way to understand I am telling. So arch of aorta, direct branch, right brachiocephalic artery, daughter. Daughter got married, again two kids. So see the family name, that is the right going on. Our family name goes right. So right brachiocephalic artery has got two branches, right common carotid artery and right subclavian. So it's all right, right going on here. Left ones, you imagine these two are sons. keep side. Only we'll focus on the right one. Right brachiocephalic artery has two branches, right common carotid, right subclavian. If someone asks you tomorrow, what is right common carotid artery? So right common carotid artery is a branch of right brachiocephalic artery. Right brachiocephalic artery is a branch of arch of aorta. So I hope it's very, very easy to remember. If someone asks you what is left subclavian artery, it is a direct branch of arch of aorta. Whereas right subclavian, see this is left subclavian which is there in the red background. This is a direct branch. Whereas the right subclavian is not the direct branch. It is the second branch. It is a branch of right brachiocephalic and then arch of aorta. So this is very important. You should learn that. So now right common carotid artery we should learn now. So this right common carotid artery, again two kits. External carotid artery and internal carotid artery. Extremely important. So we are going to study this external carotid artery. So some of you who are already started studying anatomy in your colleges, so many times you would have heard external carotid artery, internal carotid artery. But what is that branch? It's branch of what? Many people don't know. So here is your answer. External carotid artery is a branch of right common carotid artery, which is again a branch of right brachiocephalic artery, which is a branch of arch of aorta. So it's very simple. So now external carotid artery you should know in detail. So please remember a mnemonic. First of all, the external carotid artery has got 8 branches. 8. So this is a mnemonic. Some losers fail anatomy, other post magnificent scores. So this is just a mnemonic. Again, 2-3 times if you learn, you write it down in your book. It's very easy to reproduce. Some losers fail anatomy, other post magnificent scores. So these are 8 words. Now imagine this is like a train. Some losers fail are in the starting. So this is an engine is there. It is the front part. So front is anterior. So this is the anterior branches. Some losers fail. This 3. Some losers fail and you can put one slash over there. So this is anterior part. This 3-1. Last 2 you see magnificent scores. These 2 words. So in a train, last is the guard or luggage. So that is the terminal part. So this magnificent scores is the terminal part of external carotid artery. So some losers fail anterior branches, magnificent score, terminal branches. These 2 words, other post, these 2 words are posterior branches. So you can write it down. You can just make like a flower bracket. Some losers fail. These 3 are anterior branches. Magnificent score, these 2 are terminal branches. Other post is the posterior branch. Post is there, posterior branch. So now only anatomy is left. So anatomy is a sandwich between the anterior branch and the posterior branch. It is there in the middle. So the middle one is called the medial branch. Medial branch. So we have got 8 branches. Total 8 branches of external carotid artery. So that is again divided into 4 compartments: anterior, posterior, terminal, medial. So these are the branches. Superior, some losers fail. Superior thyroid artery, lingual artery, facial artery. So these 3 are the anterior branches. Ascending pharyngeal artery is the medial branch. Other posterior branches: O, occipital artery; P, posterior auricular artery. Magnificent score, terminal branches. M, maxillary artery. Scores, S, superficial temporal artery. So if someone asks you, what is maxillary artery? So maxillary artery is a terminal branch. It's a terminal branch of external carotid artery, and then that is, it's a terminal branch of external carotid artery, and external carotid artery is a branch of right common carotid, right brachiocephalic artery, and arch of aorta. So top to bottom and bottom to top, you can tell the names. So I hope I am very clear. So some losers fail anatomy, other post magnificent scores. So this is how you should learn this. This is the blood supply which you should learn By default, in any chapter, this names will come. So you can take a screenshot of this, write down in the notes, and try learning this. Now, individually, you should also know how many sub branches are there of each arteries. So that is what you can write it down and take a screenshots very fast. So the first one, anterior branch, superior thyroid artery, has got again three sub branches: superior laryngeal, sternocleidomastoid, and cricothyroid artery. Lingual artery has got again three branches: dorsal lingual, sublingual, deep lingual. Then facial artery has got total seven sub branches. Four are in the neck. Neck is called cervical, and three are in the face. So cervical part you can remember like a mnemonic: ATGS, ATGS. Facial part, inferior labial, superior labial, lateral nasal. This when we study in our first chapter, facial artery. There it will be very useful. This seven arteries. Then your other arteries, you should know the names, right? The posterior branches, that is your occipital artery, has got three sub branches. Posterior auricular artery has got one. Medial artery has got ascending pharyngeal artery and has got three. So take a screenshot. So these things you have to write it down. This all starts from arch of aorta, and you have to write like a flow chart and learn them in an order. Once you learn this, initial 2-3 days it may take time, but once you know what is branch of what, it becomes extremely easy. Then the terminal branch, superficial temporal artery, has got two sub branches, and maxillary artery, the last one, the terminal branch, it has got three parts. Maxillary artery, again all these things will be repeated in during your chapters, okay? So don't worry about that, but just I'm giving you in order. So maxillary artery has got three parts: first part, second part, third part. The first part you can remember with a mnemonic DAMAI, DAMAI. Second part are muscles of mastications. Third part is PIC pass. So all these abbreviations will fall along with the artery names. So I hope I'm clear what I'm trying to tell you, right? So please take a screenshots and you can see it again. Learn this again. So till here is your blood supply. From the arch of aorta, you come down external carotid artery. Till here is the external carotid artery. Now external over, little bit of internal carotid artery. So internal carotid artery, everything is not important here. Only the main ones I will be telling you. But still you should know the branches. Basically, internal carotid artery has got four parts: cervical, petrous, cavernous, cerebral. So in the cerebral part, you see that ophthalmic artery, extremely important. Cerebral part, ophthalmic artery. This is out of all this in this particular slide. This one you should know. If someone asks you what is ophthalmic artery, it's a branch of cerebral part of internal carotid artery. And this ophthalmic artery you should learn in detail. So ophthalmic artery, again, it has got central artery of the retina. Second one arising from the lacrimal artery. This is the sub branches. So here you see that zygomaticofacial and zygomaticotemporal. So first chapter, that is the scalp, temple and face, when you study, this thing will come. Zygomaticofacial, zygomaticotemporal. So by the time if someone asks you what is the zygomaticofacial artery, it is the branch of arising from the lacrimal artery of the ophthalmic artery. And ophthalmic artery is the cerebral part, arising in the cerebral part of the internal carotid artery. And internal carotid artery, right common carotid, right brachiocephalic, arch of aorta. I'm just tracking you till arch of aorta. So this is how you should remember. Then branches arising from the main trunk, supratrochlear, supraorbital. Very, very important. Once you read the scalp chapter, you see a diagram that like that. The blood supply of scalp, you will get the supratrochlear, supraorbital arteries. So in the very first chapter, this particular artery, this particular slide will help you out. So zygomaticofacial, zygomaticotemporal, supratrochlear, supraorbital. These are all ophthalmic artery branches. So this still here is your blood supply or vascular supply of head and neck. This much you remember as the basics. All 14 chapters you can, 15 chapters you can easily solve. There will not be anything extra apart from this. So hardly in last 15 minutes I told you the entire 15 chapters. Once you learn this, or which is branch of what, make a notebook, write everything, learn for few days, automatically it will come. Then it becomes very easy. Now coming to the cranial nerves, we have got 12 cranial nerves. I told you how to remember the 12 cranial nerves. In this cranial nerves, fifth cranial nerve and the seventh cranial nerves are extremely important. You cannot miss this. Nerves. Again, these nerves are sensory motor, which I have already explained you. So this fifth cranial nerve has got three branches: ophthalmic, maxillary, mandibular. So this three nerves comes out from some foramen. How to remember this foramens? You can remember like a mnemonic: standing room only. Standing room only. Like a room where there are no chairs, only standing. So standing room only. Standing. So ophthalmic nerve, standing. It comes from superior, standing S, superior orbital fissure. So simple to learn this. Room, next one. So maxillary nerve, room, foramen rotundum. Then comes only O, foramen oval. So ophthalmic nerve, maxillary nerve, mandibular nerve, standing room only. Now going into details of ophthalmic nerve, a mnemonic: never fall in love. Never, nasociliary, fall, frontal nerve. Again, two branches, supratrochlear and supraorbital. See, these are supraorbital, supratrochlear are the nerves. In ophthalmic artery, that was artery. So both are different. Okay, there is, even the names are same, but they have no relationship. So please understand that. So this is supratrochlear nerve is a branch of frontal nerve of ophthalmic nerve and trigeminal nerve. And lacrimal nerve is the smallest of everyone. So this is the branches of ophthalmic nerve, three branches. Maxillary nerve, it comes from foramen rotundum. So it has got four parts. The first part arising from the middle cranial fossa, the branches middle meningeal nerve. I'm just listing out all the nerves, all the blood supply together, and I'm giving you. Right. So this is like in one shot, the whole, it's like an what you say, an extra table where you should learn this in and out. So after looking this, every chapter will be very easy for us. Then branches in the pterygopalatine fossa, we have got zygomatic nerve, again two branches, spinopalatine or pterygopalatine nerve, four branches, and posterior superior alveolar nerve. Okay, so this is just an introduction. So I'm just telling you this is the way how you should learn. So this posterior superior alveolar nerve supplies your teeth, upper teeth. Your upper six you have, seven you have, eight you have. So whenever you want to extract the upper teeth, you have to give injections. So which nerve, which block you will give? Posterior superior alveolar nerve. When the anesthesia is given, the tooth gets blocked, which is supplemented by greater palatine, and then you can extract the tooth. So whenever we are studying our anatomy, I will be teaching you with the help of applications also. Like, why are we studying this chapter? Why are we studying this nerve? Why are we studying this particular question? And how are we going to implement in our life? As a doctor, how it will be useful for you? Theory, it is 3 marks, 5 marks, main question, MCQ, that is separate. That is theory point of view. But as a clinician, how it will be helping you, where all conditions you will note this, and how in diseases you need to check this. So all these thing applications also I will be discussing in the further future classes as and when the topic goes on. So maxillary nerve branches in the infraorbital groove, two branches, and terminal branches, three sub branches. So I hope I am very clear. So we are discussing trigeminal nerve, maxillary. So under maxillary nerve, these are the 1, 2, 3, 4 subdivisions. And each subdivision has what all things you have to learn this. So in the trigeminal nerve, we have discussed first one, that is your what you say, ophthalmic nerve, then your maxillary nerve, and then now the mandibular nerve. See, this maxillary and mandibular nerve branches you should know in and out. No excuse if you don't know this. because we have got maxilla, upper jaw, mandible, lower jaw. So whenever you are going to do any extraction, any filling, RCT, root canal treatment tomorrow, the tooth has to become numb. You have to give injection and numb the tooth. Anesthesia has to work there. So whenever you are giving injection, this tooth, each tooth are supplied by some cranial nerves. Which nerves? Same nerve, maxillary nerve and mandibular nerve, which we'll study again in detail when we go into this chapter. So if I just remove the tooth without giving anesthesia, patient will jump in pain. So I give injections to anesthetize this tooth. So simple. La upper three tooth, 6, 7, 8. We have 8 teeth. 6, 7, 8, posterior superior alveolar nerve. Here 5 and 4, premolars, middle superior or infraorbital nerve. Front one, you got nasociliary nerves and all. So it's very simple. Similarly, lowers, if you want to extract 6, 7, 8, 6, tooth number 6, first molar, second molar, third molar, you have to give inferior alveolar nerve block. So where is this inferior? See, we are studying mandibular nerve. Where is inferior alveolar? See here, this is inferior alveolar nerve from the posterior trunk. So this, in first year, you will study this, and when we go into details, I'll show you diagram, and during the extraction, how we give injections. That also I will teach you in first year only. So you will come to know the application point of view. So if any patient who comes for extraction, for 6, 7, 8, they give inferior alveolar, lingual, and long buccal. Three injections we give to anesthetize that tooth. And all the three are branches of mandibular nerve. This bone is called mandible. So it's very simple. So from the main trunk of mandibular nerve, you got two branches. From the anterior trunk, again, these are the branches. Posterior trunk, auriculotemporal nerve, lingual nerve, very important for the lower tooth to extraction, and inferior. So this second and third cranial nerves, or sorry, the mandibular nerves branches are the ones which we block and then remove the tooth. How to give injection also I will show you during the classes with diagrams and with some videos also. So these are the branches of mandibular nerve. So trigeminal nerve has three branches: ophthalmic, maxillary, mandibular. All the branches you should have learned in total perfection it should be. Now coming to seventh cranial nerve. So I told you fifth and seventh cranial nerves are very important. So seventh cranial nerves has got four parts. The first part within the facial canal, it has got three sub branches: greater petrosal, cauda tympani, nerve to stapedius. All these things, don't worry. Now you are seeing so many branches. What is all these things happening? One is branch of what? One is, you may be feeling like that. So this is like a table of contents I am giving you. The whole scenario of 1 year is in one particular session. So that is why you may feel little what is all those things, but it's very simple. If you know how to learn this and start practicing, 2 to 3 days you will learn this. And then you see that anatomy studying will be just fun, because the moment you tell blood supply, nerve supply, automatically answers will start coming up. Only it will come if you revise and study in a correct methodological manner. If you study anatomy in a random manner, it is going to be tough. So within the facial canal, three branches, as it comes from the stylomastoid foramen. So this we'll study in our parotid gland as well as our cranial nerves chapter. Three branches from the stylomastoid foramen. This is very simple. Okay, once you see the diagram, you will say, sir, so easy it is. Then terminal branches within the parotid gland. If you have studied first chapter, like that, one diagram will be there, face, and the one diagram will be there. How to remember these five branches? You can remember: two zebras bought my car. Two temporal, zebras zygomatic, bought buccal, my marginal mandibular, car cervical. So this little finger is the cervical, which is here. Cervical means neck, which goes to the neck. So this is going to the neck, so it's cervical. Then communicating branches with the adjacent cranial and spinal nerves. So this is all, dear students. So today what we have discussed is all the cranial nerves in order 1 to 12, up to down, down to up. Mnemonic given, you can tell. Out of that, how many are sensory, how many are motor, how many are mixed, very easy to tell. So that the chart table you remember, you can tell that. Then how many cranial bones we have, we discussed that. Then we went into the blood supply of head and neck. We started arteries, veins, and then how the veins goes into your cardiac cycle, that is physiology. And then from the arch of aorta, we discussed all the sub branches. From the arch of aorta to down, external carotid artery, internal carotid artery. So you should know top to bottom and bottom to top also, all the names you should remember. Then in the cranial nerves, we discussed all the sub branches of two important cranial nerves. That is your trigeminal nerve, which has got three branches: ophthalmic, maxillary, mandibular, and all the branches. And then we discussed facial nerve. So all the branches you should learn, revise, and repeatedly you should learn this. Over a period of time, it will come. This is it. If you know this session, what I have told, your anatomy is going to be very, very easy. Blood supply, nerve supply, everything is going to be very easy. So now, this is the basics. Mesial, distal, I hope you know that. If not, during our first class of our gross anatomy, I'll be taking all the basic terminologies, and then we'll be discussing what is anterior, posterior, mesial, distal, all those things we'll be discussing and starting the next chapter. So that's all in this basics. Please write this, write it down in the notebook, correct order, and please revise, learn as many times as you can. So that's all today in this today's session. Thank you. Thank you so much.